Hey, how's it going, YouTube? This is the Del Rey, or some of you may know me as Andrew, and I'm here to just talk a little bit about the coronavirus. You may be wondering, wow, this is super weird. This guy who used to post videos on YouTube 6 years ago, haven't posted in a while, is coming out with a new video kind of talking about the coronavirus. And there's a reason for that. I went on Twitter yesterday and I was noticing that there's a lot of misinformation and general paranoia kind of about the coronavirus. And so I thought I would take this opportunity to talk to anybody kind of just about what my take on it is, just for some background. One of the reasons why I stopped making videos on YouTube was because I had to focus more on my schooling and education. Currently, I'm a third year medical student, so I'll be a doctor in 2 years. But kind of from our perspective, seeing what the virus is and kind of what it's done so far, and just kind of looking forward, thinking about what's going to happen next. Those are things that are on all of our minds, but I'm happy to kind of talk about the facts and kind of what we know from the resources that are reputable. And for me, it's mostly a concern of dispelling any misinformation or unnecessary panic and paranoia. So the coronavirus itself, actually, some people may have read that it used to be a form of the common cold. It's one of the more common causes. I think it's the second most common cause of the common cold. But recently, the actual coronavirus itself, like other viruses, has actually mutated to create a new strain that our immune systems can't recognize. So for some of you that have had no background at all in biology, basically, we think about like infections. We think about like bacteria versus viruses. Bacteria are actually living organisms. That would be like our strep, if we ever get strep throat, or staph infections, things like that, versus viruses, which is like rhinovirus or coronavirus or other viruses like that. The main difference is, like I said, the bacteria or living organisms, the viruses, they're comprised of DNA and RNA, and as such, they can mutate, and they can form new properties about them that make it difficult for our immune systems to be able to detect them. So in this sense of the novel coronavirus, it's effectively a new strain that our immune systems are not able to identify. And as such, we have to basically start from scratch in terms of its detection as well as its treatment. So it's kind of all hands on deck from all fronts in just trying to limit the spread of this disease and try to stop the clinical manifestations or kind of how it affects people, patients in the community. So effectively, this virus was identified to originate in a market in Wuhan, China, and it has since spread to multiple international countries where the World Health Organization has now identified this as a pandemic. What does that mean? In terms of kind of its classification before to now, nothing really differently, except for the fact that we know that it can spread across, like, ocean borders and things like that. A lot of people are wondering, what does this mean for me? What does this mean for my family members? So we have information that suggests that the people who are most affected by this are usually elderly. They have chronic diseases like cardiac disease or pulmonary disease if they have something called COPD or chronic obstructive pulmonary disease, or other things like immunosuppression, either from the medications that they're taking, if they're born with an immunodeficiency, or if they're taking like chemotherapy or any kind of cancer treatment like that kind of weakens their immune system. They're more susceptible to having more serious manifestations of the disease, which is what you see in the news a lot about people that are on ventilators in the intensive care units in hospitals and things like that. So we're still understanding kind of what this virus and disease is about. What we do know from some epidemiologic studies, we're looking kind of what's the prevalence, which means how many people in a society or community actually have the disease. We have differing pieces of information because countries are screening for the disease in different ways. For example, the United States and Italy are screening based on symptoms, meaning you're not going to get a test because we're limited in tests if you are not, you don't have like recent travel, or you've been in close contact with somebody who's been positive for coronavirus, or if you have like the no typical, flu-like illnesses, things like that. Whereas in South Korea, they're actually screening across the board. So the differences in the percentage of people that have it is different, and then the percentage of people who get sick and die from it is also very different as well. Um, but what some data that has come out is that a lot of people who are in their 20s, like 20 to 29, are actually asymptomatic, but still have the virus. What does that mean? That means that you may not feel sick if you're in that age range, but you can still pass the virus on to other people, which is the importance, which is why it's important that we maintain social isolation and social distancing. We probably see that a lot in Facebook or YouTube or things like that, where you try to keep your distance safe from other people just so that we can limit the spread of the virus. Normally when we see patients in clinic or in the hospital and they come in with these viral, like upper respiratory tract infections, a lot of the times we can't actually treat them, but we tell them to make sure they're getting enough fluids, getting enough rest, and kind of letting the virus take its course. That's fairly similar to what's going on now, except for the fact that this disease is a lot more infectious. Our immune system still has to kind of take time to mount an immune response. Coronavirus in the past has been associated with SARS, severe acute respiratory syndrome, MERS, Middle Eastern respiratory syndrome. And so this is a fairly aggressive virus, but in general, our purpose is to limit spread of the virus. You may have seen a graphic where it shows kind of one curve that kind of spikes really high versus one curve that kind of flattens out. That's the phenomenon known as flattening the curve. It's effectively where, if we're able to limit the actual spread of the disease, then our healthcare systems are not going to be overwhelmed by that, right? So in Italy, for example, they're at the stage now where they're making choices between they're triaging patients the way they would in a trauma situation. Like, let's just say something really traumatic happens where a lot of people get hurt. They need to be able to decide, okay, you're really sick, you need to get the medical attention first. You're less sick, you can probably afford to wait. You're not that sick, you can wait for a long time. We have to take care of the people who are the most sick first. They're doing those things now with patients that are coming in with the coronavirus, where they're deciding, okay, like, we're going to treat you now, we're not going to treat you now, kind of thing. So this concept of flattening the curve and limiting disease spread is actually going to be beneficial, because our healthcare systems are going to be able to have the capacity to address them, as opposed to overwhelming them and having a lot of people that are not going to be able to have access to medical care at that time. So that's kind of what's going on now. So that's just kind of like my brief summary of where we stand. Obviously, we're still figuring things out day to day, and the news has a whole bunch of things about how certain things are being closed down, and how the country is addressing and assessing the risk associated with it. But things you can do now: obviously, do what everybody's telling you to do. Make sure you're washing your hands 20 seconds. Use soap. If there's limitations on hand sanitizer, things like that, make sure it has at least 60% alcohol. Don't touch your face, especially before eating. Make sure you're keeping yourself clean. Make sure you're keeping yourself socially distanced from other people, right? You don't want to be going out to like big events, parties, get-togethers, whatever. You want to make sure you're maintaining adequate distance, because it can be spread through respiratory droplets as well. And make sure you're just taking appropriate precautions. I would say the biggest thing in terms of identifying risk and kind of where we stand in that regard is making sure you're staying up to date on what the CDC and WHO is telling us. They are the gold standard resources for infectious disease control. And so physicians, practitioners, providers of all sorts are going to be listening to them in terms of recommendations of what we can do to help prevent the spread of the virus. And so that's really all I got. There's no need to panic. There is a need to be alert and to take appropriate precautions. Again, remember, staying clean, making sure you're doing the best you can to limit your interactions with other people. Because there are people out there that are going to be very vulnerable to this virus. So our strategy is to kind of let the virus run its course, limit interactions, and then kind of come up with game plans as we see appropriate. I am not a doctor, so do not take this as pure medical advice. This is just me hopefully just giving a brief summary of the information that's available online. And then, if you have any additional questions, you can always go to the CDC's website, the WHO's website. They have really good pieces on kind of what you can do. And then, if you have any direct questions, I highly recommend that you search online your specific county or area's Department of Health. They probably have a coronavirus hotline at this point. I know that my current location and my home location both have coronavirus hotlines just to answer any more specific questions. I know everybody has complex circumstances. But, again, stay alert, don't panic, and listen to the CDC and WHO. That's really all I got. Hope you guys all have a good end of your weekend, and hopefully I'll see you guys soon in a happier context, hopefully with some more music as well. A little bit of a hint there, but take it day by day. All right, I'll see you guys.